Left of the box. This is from Merritt Styles' Twitter account. She is the leader of the Ontario NDP, the official opposition. And I like to bring attention to her, not because I'm a fan, but because she's the leader of the official opposition. This is my criticism of media that always drives me crazy, how they always focus on Bonnie Crombie, the leader of the Liberal Party of Ontario, which doesn't even have official party status. But the mainstream media loves to focus on Bonnie Crombie instead of Merritt Styles. Pet peeve of mine that I always have to reiterate when I talk about it. But anyway, she tweets out in response to this little clip that we're going to get to. Remember, this is a part of the plan. Doug Ford and his politicians are dismantling our healthcare system and giving it over to folks like Galen Weston to make more billions off. So you might have heard me mention Galen Weston before in this live stream, and I've talked about him plenty on my channel. They own Loblaws and Shoppers and like all these grocery stores. So what? How is our healthcare tied to this? Well, I've posted a couple videos from a live stream not too long ago. I don't know if they're live yet or not. If not, they will be soon. He's making pharmacies like Shoppers Drug Mart, owned by Galen Weston, a place more people have to turn to get health care, because he's allowing pharmacists to be able to prescribe more medication, and he's raving about how popular it is. And it's not popular because people are choosing it. It's popular because of lack of options when it comes to having a family doctor. Because there's over 2 million people in this province right now without a family doctor. And as I always reiterate again, it's not just 2 million people without a family doctor. It's millions more with family doctors they don't have easy access to, or a family doctor they are compatible with. So it's far worse than just the 2 million without a family doctor. And so a lot of these profits are now being funneled into Loblaws pharmacies and Shopper Drug Mart pharmacies and stuff. So a lot of the healthcare dollars that should be going to the public are actually going to private sector areas, which is part of the problem. Anyway, then Galen and his friends give Doug and his politicians big bucks for their campaign, and eventually lots of swanky board appointments. Never forget that Loblaws is one of Doug's sticker company biggest clients. Yes, so Doug comes from wealth. His family owns a labeling sticker company. Like, she's not joking when she says sticker company. It's a labeling type company. And Loblaws just happens to be one of the biggest clients of his personal wealth income from his family. Like, he was born a millionaire type thing. It's all giant deal corrupt. And so there's this, Doug Ford thinks it's funny our healthcare system is struggling. He jokingly suggests people can visit an animal hospital to get an MRI. Now you might think this is an exaggeration. And this clip it's teeny tiny. And so I wanted to show a larger clip that gets more to it. So this is just 15 seconds longer, but this is what he said. This is Doug Ford. This is who the premier of this province is.
So I met Rob and Danielle, what was it, a couple of years ago. We came by here and took a look around, and at the time, my great Solicitor General, Sylvia Jones, which is now the Deputy Premier and the great Minister of Health, and by the looks of it, we know where we can send the overflow patients now for MRIs and CAT scans and everything else, so keep an extra room for some other patients.
He's talking about veterinary clinics. You know, they can now take on human patients to get some of their scans and MRIs done. You know, these veterinary clinics can take on human patients now because, you know, there's such a backlog and people desperate for healthcare that they can go. You know, maybe there'll be a deal, you know, get your cat's x-rays done, and then you can hold down your cat at the same time and get the x-ray for your arm or something.
It was a couple of years ago we came by here and took a look around, and at the time my great Solicitor General Sylvia Jones, which is now the Deputy Premier and the great Minister of Health, and by the looks of it we know where we can send the overflow patients now for MRIs and CAT scans and everything else. So
Hearing all those people behind and laughing, that's such a cute joke. So this was at a ribbon-cutting ceremony for King Animal Hospital on Tuesday. Premier Ford seemed to joke about Ontario's burdened healthcare system. Ford quipped that overflow patients can attend the animal hospital for their MRIs and CT scans. And they were all laughing. They were laughing at that.
Jones, which is now the Deputy Premier and the great Minister of Health, and by the looks of it, we know where we can send the overflow patients now for MRIs and CAT scans and everything else. So keep an extra room for some other patients.
About that. Estimated 11,000 Ontarians died waiting for surgery scans in the past year. Now, this is where I will say, to be fair or to be clear, this is worded in such a way to sensationalize it, of course. So 11,000 people died while waiting. Many of those people, even if they got the scan, there would have been nothing that could have happened. It just would have confirmed that their life was coming to a conclusion sooner than later, which is also in its own way horrendous that they didn't get that warning. So not all of those people died because they couldn't get the scan, I think is what should be made important. It's while they were waiting for it. While they were, like, I think when it comes to waiting for the surgeries, that's a little bit more of a pickle there. That's a little bit more of maybe if they got those surgeries, they would still be alive. But when it comes to the scan, a lot of them, even if they got the scan, they still wouldn't have made it. But let's see one of those people that maybe could just go to a veterinary clinic now. You know, the long wait times and stuff. They could just go to the veterinary clinic down the street.
An estimated 11,000 Ontarians have died while waiting for surgeries, MRIs, and CT scans in the past year. It is the greatest fear of so many patients currently navigating the healthcare system in a desperate search for care.
I'm medically burnt out. Yeah. It's a fight. I have a little son. He's 5 years old. And I promised him that I would be there at his wedding.
She could just go to the vet. That's what Doug Ford is joking about. This woman who's terrified she won't see her son get married, her child. She can just go to the vet because, you know, they're doing so well. As opposed to, you know, addressing the issues of why she can't get the care she needs in this province.
And that's why I fight for my family. It's my full-time job. It's a full-time job to be a patient right now.
And it is the toughest job Jordana Bailo has ever had. The 38-year-old became sick in October 2020. It took 3 years for doctors to diagnose her with a rare genetic tumor syndrome.
I am full of these tumors that can turn any minute. It's like Russian roulette. And I just have to continue to keep pushing.
In July, she had a hysterectomy after waiting a year and a half to see a gynecologist and spending months on a wait list. Recently, doctors found 4 more tumors on her back, but getting a CT scan has been difficult.
I've been on the phone with the hospital for the last 2 weeks. Nobody answers. I'm constantly waiting. It's a battle.
She's far from alone. Only 56% of patients who need CT scans and 35% of patients who need MRIs receive them within their target time. And the surgical waitlist in Ontario tops 200,000.
We are one of the wealthiest jurisdictions in.
So in case people might have just missed that because you're still horrified over what you just heard, the 200,000 people are waiting. So the 11,000 are just the people who have died waiting, but there's still 200,000 people waiting to get onto the list, to get their surgery or their scans and stuff done.
In the world, we have a moral responsibility to provide quality care to the people of this province.
CUPE's Ontario Council of Hospital Unions calling on the Ford government to make significant investments before it's too late. More than 2,000 people died on waiting lists for surgeries last year, up almost 50% from the year before. Another 9,400
50%. 50% in 1 year. Like, how Doug Ford is allowed to stay in power is absurd. People are dying because of him. And this is why I tend to keep my mouth shut with the American political stuff that's going on right now, and people saying, don't vote shame and things of that sort. And I try to keep my mouth shut as much as I can, but one of these days I'm just going full out rant on my channel about the politics here. This is what happens when you don't vote. You get people like Doug Ford in, and people die as a result. So many people in this province won't make it to the next election to try to vote him out because only 18% of people voted him in because so many people stayed at home. So many people stayed at home. So this is why I do tend to differ. Like, I'm not a fan of the vote shaming. There are some people, like, especially when you look at the federal levels, when it comes to, people don't want to support the current leader in power because of the genocide that's happening. And those people, I have no issue with the way they vote the way that they need to vote. It's not on them to fix the problems of, the systemic problems of this nation, but it's the people who choose not to vote, the people who just say, it doesn't matter, who don't care, who just like do a cursory glance or say, whatever, this one, that one, or taxes. They want to save taxes. I'll shame them. I will shame them. Because people are dying because they chose to sit at home.
Patients died waiting for MRI and CT scans. Jordana says she is fighting with everything she has not to be one of those numbers.
The hardest part is my son, my little guy. He's the most amazing kid in the world, and he is suffering, seeing me sick. I have to get better for him.
In a statement, a spokesperson for the Minister of Health tells us the government is expanding capacity across the province, getting shovels in the ground for nearly 60 hospital developments over 10 years that will add thousands of beds across the province to connect Ontarians to the care they need now and into the future. For City News, I'm Tina Yazdani.
They just kind of have to throw that in there, but, it's not going to happen. And a lot of the new beds and stuff will be for private institutions. He said that comment about the veterinary clinics a little while ago. And do you think he actually feels anything about it? So this is from D. Resident, a very good Twitter account to follow. And so they post Doug Ford on his jokes about sending people to animal clinics for MRIs. All just a little bit of fun. This corrupt goon needs to resign. He doesn't care about anyone but himself and his media donors.
Well, Premier, I thank you for your time today. I know it's going to be a great time tomorrow. I know Gore Krantz is going to be attending. Z Hamid will be there. It's Country Heritage Park tomorrow at 5 p.m. Have a great one. And let me just throw something at you. Maybe we hold off on the MRI jokes tomorrow.
Yeah, we'll hold off on those ones. But, it's all a little bit of fun, but there's no government that's put more money into healthcare. It's unprecedented amount. for the people of Ontario. But thank you. Fun, but there's no one. But it's all a little bit of fun, but there's no one, no government that's put more ones. But it's all a little bit of fun, but there's no one, no government that's put more.
Tell that to her. Tell that to her. It's all just a little bit of fun. And then what did he say at the end of that?
Money into healthcare. It's unprecedented amount. No government has put more money into healthcare. It's unprecedented amount for the people of Ontario. But thank you.
From BlogTO, Ontario spends less on healthcare per person than any other province in Canada. I'm sorry, what did you lie? Public confidence in government services in Ontario has been rapidly eroding since the pandemic, and new study on healthcare expenditure nationwide only serves to add insult to literal injury. A local law firm this month delved into the data about what different provinces invest in the sector, and sadly, Ontario came out at the bottom of the list. Healthcare spending is a critical aspect of public policy and quality of life in Canada, and the expenditure per person varies significantly across the provinces, the report from the Toronto-based Presler Injury Lawyers states. Well, somewhere like Nunavut spends, based on Canadian Institute for Health Information data, nearly $24,000 per person resident annually. Canada's most populous province devotes only slightly more than $8,000 per person per year to medical needs. Now, they're going to mention something, and I do want to reiterate this. I think, did they say it here? But keep in mind, this sounds like a hell of a lot more. It's kind of not. Okay. By comparison, in BC, Alberta, and Saskatchewan each spend just north of $9,000 per constituent yearly on healthcare, while East Coast provinces allocate between $8,400 and $10,300 per citizen. Those numbers are a little bit more comparable, I'll say. They're more comparable. And so they do mention it in this article, I believe. Okay, yeah. Of course, there is a vast difference in each part of the country's population, location, infrastructure, and many other factors to consider before deducing that this is necessarily a negative thing for Ontario, with the study itself stating that effectively the efficiency of healthcare systems and the emphasis on preventative care can have an impact on overall costs. Okay, so the reason why I'm saying, when it comes to Nunavut, Northwest Territories, Yukon, of course they're at the top. Of course. Because everything up there is so much more expensive. Just everything. Bazillion times more expensive. So when you look at BC, though, Alberta, BC, Saskatchewan, they're more comparable to what we have here. And yes, Ontario is the most populous province in this country. But that shouldn't matter. Then we should have more hospitals, more family doctors. And instead, we're getting less spent on per person yearly out of the entire country. But here he's saying, oh, we spend the most on healthcare, most. But he's putting a lot of that money into the private sector. Let's see what. But for people already stressing about direction of healthcare system is going, with emergency rooms closing down, family doctors progressively harder to find, and private clinics on the rise, finding out that Doug Ford's leadership earmarks such a paltry amount can understandably confirm and stoke existing fears. Yes. We have emergency rooms that close down. People who, if you need an emergency, you need to schedule it, maybe not on a weekend. Family doctors are difficult to find. More money is being shoveled into the pockets of Galen Weston, corporations. And he's fine. He's fine. He doesn't care. He's rich. He can joke about it. It's all just a big laugh to him. And meanwhile, what is he spending money on? Doug Ford increases size of Ontario cabinet again in latest reshuffling. So he is already, his office is already costing twice as much as the previous government's office. So when the Liberals were in power, he's already, like, when it comes to payment of ministers, the cabinet size, how much money they get, he keeps on having money go into the pockets of himself and other conservative MPPs, as opposed, to where we actually need it. Ontario Premier Doug Ford has bolstered the size of his cabinet to 37 ministers and associate ministers following a mini summer reshuffle, breaking his own record for the province's largest cabinet. On Friday, Ford was forced to move around his top team when Todd Smith stood down as Minister of Education barely 2 months after taking the job. Yeah, there might be issues there if you're taking scandal or something's wrong. But we don't need to get much more into that. It's just the way Doug Ford spends money is gross. He spends it on things that aren't necessary. Last live stream, or 2 live streams ago, pointed out the $134 million on 5 police helicopters. He'll spend money on that. But to make it so that, this woman can get the MRIs she so desperately needs, don't have the money for that.